resolution proclaiming September as Peripheral Artery Disease Awareness Month in Lumberton, Texas. Date proclamation issued September 12, 2022. Whereas the Way to My Heart, a 501c3 nonprofit focusing on education, advocacy, and support, has recognized the importance of September being designated as p.a.d. Awareness Month. And whereas the intention of the proclamation is to educate the public that leg health can be an indicator of risk for heart attack, stroke, amputation, and to encourage a candid conversation between a patient and their physician about risk factors. And whereas coronary artery disease remains the greatest cause of morbidity and mortality in the U.S., with upwards of 42% of patients with CAD also having peripheral artery disease. And whereas timing of education is critical, as delays in diagnosis and treatment of p.a.d., mainly in the highest risk diabetes group, due to COVID-19 pandemic, has led to a 50% rise in related limb, 18% in 2019 to 42% in 2020. And whereas major amputation leads to severe morbidity and is associated with a high one-year mortality rate of 44%. And whereas people of color having a disproportionately higher rate of amputation than their white counterparts. And whereas within 1 in 20 people over age 50 and 1 in 5 over age 60 believed to have p.a.d., and numbers rising rapidly with the aging of the baby boom generation. And whereas the diabetes epidemic in Texas impacts more than 5 million adults who have pre-diabetes or diabetes. And p.a.d. is one of the most prevalent diabetic complications which can lead to amputation. And whereas 70% of p.a.d. patients polled globally by the Way to My Heart had not had a pulse examination performed by their primary care provider at the onset of symptoms, including leg pain, leg cramps, neuropathy, numbness, tingling, and non-healing lower extremity wounds. And whereas early detection of p.a.d. is critical evidence of more widespread atherothrombotic disease and might result in a reduction of substantial risk of subsequent cardiovascular events and deaths, as 1 in 5 who are left undiagnosed and treated will suffer a heart attack, stroke, or death within 5 years. And whereas the purpose of Peripheral Artery Disease Awareness Month is to encourage early detection of p.a.d., to reduce limb amputations, and to raise awareness that leg health can also indicate risk for heart attack and stroke. Now therefore be it resolved that the Lumberton City Council hereby proclaims September Peripheral Artery Disease Awareness Month. Be it further resolved that Peripheral Artery Disease Awareness Month encourages all Lumberton, Texas citizens to recognize that it's important to understand that leg health can indicate risk for heart attack, stroke, and amputation. Signed, Don Surratt, Mayor.
I'm Douglas Salisbury. How are y'all? Good talking to you.
Yes, sir, you have.
So I give a little brief. As a couple years, about 3 years ago, I was working 2 jobs, doing about 15 yards a month, and started having leg issues with walking cramps and that, and went to my primary doctor, and he thought I was just getting old. Of course, I'm 61 now, so he figured that's what the problem was. So I got to a point where I was doing her yard, and I fell. And I said, that's enough. Something's really wrong. So for the last 3 years, I've gone through 4 major surgeries. I've had 2 kissing stents, both of them failed. Then I had an aortic bifemoral bypass that cut me from top to bottom. It failed. About right at 8 months ago, I had an axial bifemoral bypass. They cut me from here to here. It goes into both legs. It has now failed also. So I was given 2 to 5 years. Through that process, I now have atypical variant cardiomyopathy, which is a very rare heart disease caused by my bypass being blocked. So every day I live with just pain every day, walking, sitting. I can't sleep at night, sitting comfortable. It's horrible. And I'm here on behalf of thousands of warriors. I'm on the committee with the p.a.d, the Weight of My Heart. We have a walking group. I run a walking group. And the main thing I wanted to express to y'all is next time you go to your doctor, have him check your feet. Make sure he checks your feet. It takes 5 minutes for a doctor to check your feet for your pulses. If you're not getting the right pulses, you need to be with the right doctors. So I now drive to Houston 2-3 times a month, and I'm with a set of doctors now that are trying to make my 5 years a little bit longer than what I have. So I wanted the city of Lumberton, and I'm just trying to express to everybody, make sure you check your feet next time you go to your doctor. All of us need to make sure we do that, because it's a serious disease. Every 20 seconds in the United States of America, somebody loses a leg. So when I had this surgery, he called her and my brother and said, if we don't do this bypass, he will lose his leg. And I'm at that point now where with this is blocked, I'm hoping that the doctors in Houston can save my left leg. Otherwise, eventually I'll lose my left leg also. So the real importance of prevention is the number one thing, is have your feet checked when you go to your doctor if you're age 50 or a little bit over. Okay? So it's a very serious disease. Every day we deal with people across the country. The waytomyheart.org is a major group, and we have a p.a.d group that we run that in the UK and Canada. Canada actually in the UK had more amputations than the United States of America does every day. That's like 1 every 10 seconds or something like that, somebody loses a leg. And I just got back from Chicago. The technology out there now to prevent leg amputation is incredible. But we have doctors that don't know. And there are doctors out there now trying to get all that information out. They don't do this bypass anymore. They can actually now go through the bottom of the foot and clear passages. They're now, instead of, if you don't have the veins to get blood flow to areas, the arteries to get blood flow, they're now using veins to do it. So the technology now is incredible. And that's what we're trying to get out there to the world right now, to prevent the number one thing, leg amputations. 1 every 20 seconds is not good. So it's all about information and getting that information out. And that's what I wanted to share with y'all.
Well, thank you.
Thank you so very much for being here.
And may God bless you.
Thank you.